Hi, my name is Foreman. Today I'll be showing you how to examine a shoulder joint, or how I examine a shoulder joint, and here's Matthew, my patient for today. So first of all, I'll ask Matthew to face towards the camera and we'll do a general inspection of the shoulders. So here we're looking at the general shape of the deltoid muscles, the pectoralis muscles, the biceps, looking to see that the clavicles are nicely aligned and that the shoulders are nicely aligned there on the same level. We're looking for any signs of muscular wasting of the deltoids, of the biceps and the pectoralis muscles, for any obvious surgical scars, any bruising, or any joint swelling at all. So if I ask you to move to the side, we'll be examining your right shoulder for the purpose of this video. Again, observing the shape of the deltoid, nice and round, the triceps, biceps, and if I ask you to face back to the camera. Now we're going to be looking at the trapezius muscles, looking for any obvious wasting of the trapezius muscles here. We'll be looking at the scapula to make sure that they're nicely aligned, and again the shape of the deltoids, any obvious surgical scars, swellings, muscle wasting of infraspinatus, which can be quite common, and yeah, that all looks quite nice and fine to me. So first thing I'll ask you to do is if you can go up to the wall for me here and put your hands up against the wall. And now whilst Matthew's doing this, I'm looking at his scapula here at the back, just making sure there's no winging of the scapula, which could suggest a long thoracic nerve problem. His scapula aren't winged, which is a good sign, so if you can come back up for me. Now with the shoulder joint, it's also important to screen the joint above, and the joint below, but the joint above, which is the C-spine, the cervical spine. To do that, I'm going to come on the corner and ask Matthew to turn face on to the camera. Any pain in your neck at all? No. And I'm going to start by palpating the bones of his cervical spine. Any problems doing that? No. I'm also going to palpate down the trapezius muscle on the right hand side. Any problem there? No. And on the left. And the spine of the scapula. And around his right scapula, asking if he's in any pain or discomfort. No. No. You can also feel infraspinatus, supraspinatus there. Right, that's all normal again, which is good. Now with Matthew's back to the camera, I'm asking him to lift his arms in the air, all the way above your head, as if you're going to clap above your head, and back down. And if you carry on doing that for me, here we're looking at the shape of his scapula, looking for the movement of his scapula, just to make sure it's equal both sides and normal. In this case, it looks nice and normal. He's got a good range of motions of abduction and adduction of his shoulders there. That's great. You could turn back around the front for me. So now we can move on to palpation of the front of the shoulder. We're going to start at the sternoclavicular joint on the right hand side. So if we start here, we start sternoclavicular joint, palpating along the clavicle to the acromioclavicular joint. Any pain there? No. Down to the head of the humerus. Trying to feel for the greater tuberosity. With muscle mass is quite difficult. On the back of the shoulder joint. We've already palpated the back. You can also feel the muscle bulk of the pectoralis, just to make sure there's no wasting there. So there's no pain when I did that? No. Okay, that's fine. Now we're going to move on to the movements, range of movement of the shoulder joints. So I'm going to first ask Matthew to flex his shoulder up for me, above his head, and back down, and then behind yourself. So normal there is about 40 degrees, and we should be able to get to 70 to 180 above, which you can, normal range of movement there. We're going to do abduction away from the body and above your head. That's great. Again, 180, which is normal. And back across your body this time, adduction, which again is normal for him there. Now we're going to do internal and external rotation. So if you bring your elbows nice and tucked inside, if you cross your fists across your body, that's internal rotation, which is normal for him. And then back outwards, external rotation. Again, a normal range of movement. Now, a quicker way that you can assess the movements of the shoulder are to ask the patient to put their hands behind their head. This tests external rotation, abduction and flexion, and then hands up behind the back if you turn towards the camera for me. This is internal rotation, extension, and yeah, so that's internal rotation and extension of the joint there. Now, what we can do is, just to check for a normal range of motion, we can look at the level of his thumbs at the spine there, and as you can see for him, they're both equal, which is good. That's great. Now what I'm going to do is I'm going to pass it, we can come back around, and turn around to the camera for me. Now I'm going to passively move his shoulder joint. So we're going to put this way, just feeling for any crepitus in the shoulder. And then if you flex your arm for me, that's it. In and out. And again, he's got the same range of motion when he does it himself as to when I'm doing it there. Now we're going to test the strength of some of the muscles in the shoulder girdle. We're going to start by doing the empty hand test, where I ask Matthew to put his hands out like this for me and point his thumbs towards the floor. Now I'm going to press against his arms, giving him some resistance. And if I ask you to resist me when I'm pressing you down, don't let me push you down. He's got normal power there, which is good. Now I'm going to ask you to do this for me. And don't let me push your hands together. Checking infraspinatus there. And now with your hands behind your back, like we did before, and turn onto the camera, can you bring your hands away from your back for me? And don't let me push them in. Again, good power there. Checking subscapularis, which is good. Right, so now we need to check for impingement of the shoulder joint. To do this, we've got Hawkins and Neer's tests. First of all, we'll start with Hawkins' test. So I'll ask Matthew to flex his arm up for me. Rest it over my arm here. So he's got his arm in an internally rotated and flexed position. I'm going to press down on his hand, asking if there's any pain there in his shoulder joint.
No.
What we're trying to do there is we're trying to catch the tendons underneath the acromioclavicular joint, which would elicit some pain. Now we're going to do Neer's test, which is external rotation of the arm. And now we flex this above his head and give a bit of resistance at the back. Any pain or problems there. Another one we can check for is the painful arc, but we've already done this numerous times. If Matthew can do this, above his head, that's fine. And then back down to about this position. People with impingement of the shoulder can get a painful arc here in this sort of area, in those sort of degrees, when they're lifting their arm above their head, if they've got any signs of a shoulder impingement. That's fine. Now we're going to check for the stability of the shoulder joint. If we think an athlete has got an anterior dislocation of their shoulder, we can do something where we press on their shoulder to see if they're apprehensive about it. It's called the apprehension test. And if I ask Matthew to lie down for this one, and if we ask the camera to come round just to the end of the bed here, with the apprehension test, we flex and externally rotate the arm, bringing it out here. And what we do is we put a bit of pressure on the shoulder and we push back. And what I say to you, are you apprehensive about me doing that?
No.
No? Some people feel like their shoulder's going to pop out. And if that's the case, you can add more pressure for the shoulder if it makes them feel more comfortable. And the way we're supposed to do the apprehension test is to lift your hand off very quickly, and it makes the patient very apprehensive, but it's not a very nice test to do. Last thing, I'll ask Matthew to sit on the edge of the bed for me, and just face this way for me. And we're going to ask the camera to come around here. Just to check for any shoulder joint instability again, we can do something looking for sulcus sign, where we grab the arm and we pull down towards the floor. Now if there's any instability in the shoulder joint, we may see a sulcus appearing here, suggesting that there is laxity in the shoulder and a bit of instability. Again, Matthew, this is a normal examination. Now to complete my examination, I'd screen the elbow joint and I do a full neurological examination of Matthew's arms to make sure he's neurologically and muscularly intact. That's how I examine a shoulder joint, so thank you.